I told you yesterday that I woke up to the temperatures being in the upper 40s. Well, today it was 38. So I don't know what's going on. It's beautiful now, though. It's like 50 something, sun shining. It's nice. Anyway, I want to keep talking about this restless leg syndrome thing. So we already know that it's a condition that affects your sensory motor system. And but how is it diagnosed? So are there any specific diagnostic studies that can confirm that this is in fact what you have? Well, first of all, it's usually just based on the patient's description of what they're feeling. And so the patient may describe it as a creepy, crawly sensation in the legs, or pins and needles, or an internal itch that you can't scratch. And it's sometimes very painful and it's very unpleasant. I already described that it can occur during sleep, but also can occur in the evenings if you're just sitting still. Getting up and moving around may relieve those symptoms some. Um, but that's what patients will describe when they go see their provider. There's another similar diagnosis that's actually a little bit worse than this one, and it's PLMS, periodic limb movements of sleep. And this is characterized by involuntary and forceful dorsiflexion of the ankle. So dorsiflexion, if this is your foot right here and this is your ankle, it's like this. It just forcefully dorsiflexes. And I have had that. It's weird. It's like a really bad cramp that happens, and it just all of a sudden your foot will just move involuntarily, and like somebody pushed it, but nobody did. So it can last anywhere from zero point 0.5 to 5 seconds at a time, and it can actually occur every 20 to 40 seconds while you're sleeping. It's crazy. So if your provider, if you go to your doctor and they're like, what's going on? And they may not even ask you, you might have to volunteer this information. But when your provider should really be asking you a few questions about your sleep habits or your quality of sleep, especially if you go in for like an annual checkup or something like that, or if you go in complaining that you're fatigued and you just can't get going, then they should be asking you about your sleep habits. So if they don't, then bring it up to your provider. You can experience a lot of sleep disruptions with this condition. You can have some daytime fatigue or somnolence, where, if you sit down, you may just kind of fall over and go to sleep, take a little nap or whatever. And it's because this sleep cycle is interrupted with these jerky limb movements. And, there's some other things that you need to consider. Most likely it's either restless legs or PLMS, but it could be that you've got neuropathy. You could just be having leg cramps, which I don't agree with that, because if you've ever had a calf cramp, it's different from just a movement. You could also have vascular disease, which affects your blood flow, or you could have radiculopathy, and radiculopathy actually stems from something that's going on in your low back. So those are all things to consider if you are finding yourself waking up with this condition. There are some diagnostic studies to consider, and one of those is to determine whether or not you're anemic. So you need to have like a complete blood count, a ferritin level, an iron level, transferrin saturation, and total iron binding capacity. If you have abnormal findings on a neurological exam, then other labs need to be ordered. They need to assess your kidney function through your BUN and creatinine. They need to do a fasting blood glucose, a magnesium, a thyroid stimulating hormone or a TSH, a vitamin B12, and folate. And it would be very helpful if you know if you have an MTHFR gene defect or not. If you do, then, and you're anemic and you're trying to correct that with regular iron supplements, it's not going to work, because your body's not going to metabolize regular iron appropriately. So you have to go with a methylated form of folate or iron or B12 or all three. You could also undergo an EMG or a nerve conduction study. So if they're thinking that, it's not RLS or PLMS, but it could be more like a polyneuropathy or a radiculopathy, this nerve conduction study can help determine that. So they take you in and they put these they got a machine that's got these two little metal metal probes on the end of it, and they go along the pathway of the nerve and they stimulate that nerve, and then they look at the computer screen and their computer program, and they can tell if the nerve is responding appropriately or overacting or underacting to that stimulation. And then they also do, like, it's almost like an acupuncture needle. So they'll stick this very fine needle into whatever nerve it is that they're looking at. And they can determine through this study if you've got nerve impairment or nerve impingement going on someplace. So that's the way we diagnose this issue. Again, it's usually just totally based on patient's description of what they're experiencing. But if there's more to it than that, then some other investigative studies need to be done. So tomorrow, I'm actually going to talk about the conventional methods of treating restless leg syndrome. And this is obviously a pharmaceutical topic. So we're going to get to the cannabis thing eventually here. Because that's what I'm leading up to, right? So anyway, you guys have a great rest of your day. If you're in Florida, stay safe. God bless.